Bonjour tout le monde. Bon matin. Good morning, everyone. Moi, je veux que le headline dit que c'est pas si pire que ça. Non, je peux pas dire ça, mais c'est pas si pire que ça. Le progrès du Nouveau-Brunswick en vue de la reprise durant la pandémie du COVID-19 ont été mesurés et prudents, mais nous avons avancé. Ça, c'est des bonnes nouvelles. Au cours des 8 dernières semaines, nous avons graduellement levé bon nombre de restrictions des mouvements publics imposés par l'état d'urgence dans la province. Les entreprises ont rouvert leurs portes, les activités communautaires ont repris et les familles et des amis sont retrouvées. Et so we are learning as we go and incorporating new information at each step. And when I opened my opening remarks in French, I was saying, I wish the headline would read, "It's not that bad." So today, all of New Brunswick, except Zone 5, will be moving forward to the next level of the yellow phase of recovery, and the Premier will address those details shortly. This new phase will allow more gatherings, more activities, more access to family, and more travel from outside the province. And with every step forward, there are risks. Plus que jamais maintenant, il est essentiel que chacun aux 4 coins de la province soit attentif aux signes d'une infection par le COVID-19 et que nous continuons à prendre des mesures pour en ralentir la propagation. Nous avons réussi à contrôler la pandémie dans l'ensemble du Canada. Et toutes les informations qu'on a sur les autres provinces, ça améliore la situation autour du Canada. Puis ça, c'est des bonnes nouvelles aussi. Cependant, la COVID-19 est toujours parmi nous et le sera encore pendant un certain temps parce qu'on sait que dans le monde, dans d'autres pays, ça va pas aussi bien. Alors, il faut vraiment toujours nous rappeler de ça. Mais les perspectives ici au Canada sont meilleures et le nombre de cas au pays ne cesse de baisser depuis plusieurs semaines et le nombre de cas de guérison a continué d'augmenter. Encore des bonnes nouvelles. This has given us time to prepare our healthcare system for more cases, and there will be more cases in the weeks and months ahead. But what is really good as well about the situation is that each and every time we're dealing with new cases, we are learning more at the regional level and at the provincial level. Each case is really looked after at the regional level, and our medical officers of health are really, really involved in all of the details around the management of these cases. So again, I want to give a shout out to our medical officers of health, Dr. Paquette in the north, Dr. Legere in the east, Dr. Lamptey in the central region, and Dr. Barker in the south. These people work tirelessly each and every time there is a new case, and they work with the public health teams to track down and trace the contacts, et cetera, and follow up on them. So great, great work all around the province. New cases are not a sign of failure. They are a reality. They will happen, and we need to be ready for them, and that's what, again, with each and every case, with each and every outbreak, we're learning more and more information that we can use in the future. Our goal remains the protection of the most vulnerable citizens and securing our healthcare system and isolating new cases when they emerge. This won't change. Today, there are no new confirmed cases of COVID-19 in New Brunswick. Also good news. Aujourd'hui, il n'y a aucun nouveau cas confirmé de COVID-19 au Nouveau-Brunswick. Des bonnes nouvelles. With each phase of our recovery, we have taken carefully calculated risks, and we have gradually increased the level of interactions for families, communities, and businesses to allow time for everyone to adjust to these new circumstances. With this new phase, there will be an opportunity for greater interaction. There will be a requirement for self-monitoring and self-isolation, which reduces but does not eliminate that risk. And again, we can measure the risks that we're exposed to by how likely it could be that you could contract COVID-19 with some of those interactions. So obviously, closer contact indoors versus farther away contact outdoors and the scales of things in between that. So make your choices accordingly. It will still be very important to maintain physical distancing and continue good hygiene practices. And I think as we socialize, it is still the instinct is still to want to hug people, and again, we have to think about who we want to have close contact with in terms of the number of people that we interact with. As I have said before, we can't stand still forever. We must get on with our lives and adjust to this new normal, which is our reality right now in terms of continuing to deal with new cases as they arise. And fortunately, at this point in time, again, we haven't had a new case for a couple of days, and the situation as it unfolds in Zone 5 has been improving in terms of what we are learning and the cooperative work that's being done with Vitalité, with Horizon, with Public Health, and with the Department of Health, and as well as all of our partners and frontline workers, and also with the Manoir. So there's quite a bit of collaboration happening. But with Zone 5, we haven't been able to move forward at the moment, but the plans are in place to look at that in the next little while. So to give hope to Zone 5 in terms of what's happening, at this point in time, we have seen 40 cases in total, and it was and 2 deaths. And the outbreak has been centered in the seniors' home and the local health institutions. Jusqu'à présent, rien n'a montré que le COVID-19 s'était répandu dans l'ensemble de la collectivité ou dans toutes les régions du Nouveau-Brunswick. Pour en avoir l'assurance, nous améliorons les protocoles relatifs aux tests de dépistage pendant 1 semaine. Toute personne au Nouveau-Brunswick qui présente l'un des symptômes communs de la COVID-19 devra passer un test. L'auto-isolement n'est pas exigé, mais il faut se surveiller. Si les tests confirment l'absence de la propagation communautaire, la zone 5 passera à la phase jaune dès le vendredi, le 26 juin. Encore des bonnes nouvelles. In the meantime, the people of the Campbellton region continue to require our active support, and I really can't emphasize that enough. Every region of this province will probably undergo similar situations. Hopefully that won't be the case, but we know that the possibility and probability is there. So when and if it comes to your community, again, we want to be able to say that we were there to support the individuals and the communities who needed our help the most. And I'm aware that businesses in other regions have been asking customers if they reside in or have traveled to the Campbellton-Restigouche region. That's not necessary. Sometimes customers are turned away because of where they live, and that's not okay. This is really not helpful. So I have advised yesterday that we are no longer advising against non-essential travel, so people can travel freely around the province. Everybody who has been exposed to a case of COVID-19 is self-isolating at home right now, and the people who are at risk are being tested, and as well as everybody in the entire province of New Brunswick, if they have symptoms, are tested. So, and now that we've lowered the list of symptoms to just 1 in terms of the list of symptoms that we have in terms of the criteria for getting tested, we do know that we have the capacity to be able to offer that to New Brunswickers. So there isn't any reason for people to not get tested if they have 1 symptom at this point in time. And again, taking into account the risks around the province at any time. No one should be discriminated against for living in a community where COVID-19 is active, and it may happen in your community. So again, let's take that into account when we're making our choices and our decisions around our actions and our words. Remember to treat others as you would like to be treated, with kindness, compassion, and respect. And remember that we are all in this together. And again, I understand the fear, and I do understand the concern. That is unquestionably the driving force of some people's actions and behavior. But I think with the right information, we can counter that fear with facts. And when we look at the facts, again, the COVID-19 cases that are in Zone 5 right now and elsewhere, those people are self-isolating, the contacts have been traced, testing is continuing, and everybody in the province can be tested right now. So I don't feel that there's a risk to the public right now with respect to doing things in the community, with businesses, et cetera. So the same baseline advice from public health throughout this entire pandemic does stand today. Hospitals will screen for patients arriving from an outbreak area and will isolate those patients from others under their care. And I know this can cause concern as well. I did hear from people who found this troubling. And I think it's a matter of just making sure that people have the right expectations when they're attending a facility outside of the zone, and perhaps preparing ahead of time. But certainly, there would be no caregivers or hospital workers that wouldn't be sensitive to that, but everybody is doing their best. But just knowing that if people do feel stigmatized and ostracized unnecessarily, that does cause some trauma with respect to the effects of that. So again, we really have to be sensitive to how people feel around COVID-19. N'oublions pas que nous sommes tous solidaires. Dans un milieu de soins de santé, il faut toutefois appliquer une norme différente à cause des risques accrus de propager l'infection. Les hôpitaux feront un contrôle des patients qui arrivent d'une région touchée par une éclosion et leur isoleront des autres patients dont ils s'occupent. And this is to be done with kindness at all times and with professional courtesy, which I trust the frontline workers to be doing. And again, we are all in this together, and we do have choices to make around how we interact. We have seen how quickly this virus can spread in a healthcare facility, and these measures are designed to help prevent that from happening. So any closed setting, whether it's a nursing home or a hospital setting, some work settings, et cetera, it's really important that we minimize those risks. We will continue to work to slow the spread of COVID-19 to protect our most vulnerable citizens as well as our hardworking frontline healthcare workers. We all have to do our part. Please keep doing the things that you've been doing. Whenever you can, maintain 2 meters between yourselves and others, and when that isn't possible, wear a community face mask that covers your mouth and nose. So have that mask with you at all times. Wash your hands, clean regularly touched surfaces in your home, and avoid touching your face. And really try to keep the number of close contacts you have very, very low. Mais par-dessus tout, soyez bienveillants. Soyez bienveillants envers vous-même et soyez généreux envers les autres. Si nous faisons tout cela, nous pouvons nous assurer de ne laisser personne derrière pendant que nous avançons. Merci.
Good morning, bonjour. This week is National Public Service Week, and I want to take a moment to recognize the hard work and dedication of the New Brunswick Public Service. Over the last few months, our province has been put to the test by the coronavirus pandemic. Dès le premier jour, notre fonction publique s'est mise au travail pour trouver de nouvelles manières de fournir les services importants aux gens de Nouveau-Brunswick. Je suis fier de la manière dont les fonctionnaires de Nouveau-Brunswick ont accepté de relever les défis associés à cette normalité, mais aussi des manières innovatrices qu'ils ont trouvées pour continuer à faire leur travail. On behalf of all New Brunswickers, I want to thank the New Brunswick Public Service for all that they do. Though we face uncertain days ahead, I am confident that our public service will continue to put New Brunswickers first, providing the exceptional service we have come to know and expect. Today, all areas of New Brunswick, with the exception of Zone 5, the Campbellton region, will move to the next phase of the yellow level of recovery. Due to the continued outbreak in Zone 5, the Campbellton region will remain at the orange level for now. This is a situation that we will continue to monitor closely, with the hope of returning the area to the yellow level by next Friday, June 26th. For the rest of the province, beginning today, indoor visitations at long-term care facilities will be allowed, if the facility is able to accommodate. Au seul visiteur à la fois sera autorisé, à moins que le visiteur ait besoin de soutien, et dans des cas, 2 visiteurs seront autorisés. Les nombres de visiteurs devront être donnés à l'avance à l'établissement. Tous les visiteurs devront porter un masque pendant leur visite et ils devront respecter toutes les autres politiques et pratiques mises en place par l'établissement. Again, I want to be clear, while we are giving these facilities permission to allow indoor visits, I know not every facility will be in a position to do so immediately. Facilities will be required to develop a plan to manage visitations in advance. As well, effective today, overnight camps will be allowed to open. As previously noted, they will need to put safety measures in place provided by public health, including physical distancing, enhanced cleaning, and screening for children, parents, and staff. They will also need to develop an operational plan before they open. Currently, churches, swimming pools, water parks, skating rinks, recreational facilities, and sports events are limited to a maximum of 50 people. This restriction will be removed effective immediately. However, indoor events that have controlled entry or controlled seating are required to take the names and contact information of attendees to make it easier for public health to follow up with people should there be a COVID-19 exposure at the facility. While the loosening of these restrictions only applies to areas currently in yellow phase, the following will apply to all areas of New Brunswick, including Zone 5, the Restigouche region. New Brunswick residents no longer need to self-isolate when returning from another Canadian province or territory where they have been working, but they should self-monitor. Si vous étiez à l'extérieur de la province pour une autre raison, vous devrez vous auto-isoler pendant 14 jours, à moins d'avoir reçu d'autres instructions précises. Si vous revenez d'un autre pays, peu importe la raison de votre voyage, vous devrez vous auto-isoler pendant 14 jours. Canadian residents that own property in New Brunswick will be allowed into the province as of today to visit or stay, provided they self-isolate for 14 days or for the duration of the visit if they're staying for less than 14 days. As well, the Canadian residents that have family members in New Brunswick can come to the province as of today, but are required to self-isolate upon arrival for 14 days or for the duration of their visit if they are staying less than 14 days. Comme je l'ai déjà mentionné, la zone 5, la région de Restigouche, va demeurer dans la phase orange pour le moment. Nous devrons nous assurer que l'exclusion actuelle a été contenue avant de pouvoir sortir de zone 5 de la phase orange. As long as the virus infection numbers remain manageable, the Restigouche region will join the rest of the province and move to the full yellow phase on Friday, June 26th. As well, if the virus infection numbers remain manageable, all remaining businesses can open in New Brunswick on June 26th if they're able to ensure proper sanitizing and physical distancing measures are in place. The concept of a full Atlantic bubble is still on target for early July, as I've mentioned previously in numerous releases. And I'm looking forward to working with my colleagues in that regard in the coming days. We will also be continuing to evaluate and pursue further travel opportunities throughout Canada later in July. Let me be clear, these steps hinge on our ability to continue to manage the spread of COVID-19. Même si les restrictions sont assouplies, nous devrons demeurer vigilants. Les mesures que nous avons prises et que nous allons continuer de prendre permettent de minimiser les risques pour notre population. Mais le virus est toujours présent et il le serait encore dans l'avenir prévisible. Working together, we can manage the spread of COVID-19. Doing so will enable us to continue to reopen our economy and put New Brunswickers back to work. 2/3 of New Brunswick businesses are fully open already, more than any other province. We have had the second highest job growth in Atlantic Canada, with 16,700 jobs added in May. Consumer confidence in New Brunswick is at 81%, the highest in Atlantic Canada. 80% of daycares are now open, allowing parents to go back to work and help reignite our economy. Nous sommes sur les bonnes voies en prenant les décisions difficiles et les mesures nécessaires alors que nous composons avec cette nouvelle normalité. We should be proud of what we have accomplished so far and remember that we have got in here by working together. While there are sure to be challenging times ahead, we can be assured that together we will overcome those challenges as well. As we head into this weekend, I also want to make people aware that a fire ban is now coming into effect. The Minister of Natural Resources will issue a release later this morning and discuss further details as needed. But with this extreme heat and dry conditions that we are experiencing, we are closing our Crown lands and asking everyone to stay out of the woods. We cannot be too careful. This is an unusual year, as I'm sure everyone across the province will agree. And as a reminder, a fire can be started as easily as the exhaust from a vehicle or an ATV in these extreme dry conditions. So please, we've protected ourselves. Now let's protect our forests and our property. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Merci beaucoup. We will now proceed with questions from the media. You have the right to pose your questions in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Inda and Tira huddle today.
Good morning. This question is probably both for the Premier and Dr. Russell. What led to the decision to think about an Atlantic bubble and later also opening up to the rest of Canada in terms of risk for the health of the community, given that the situation is different all across the country?
That's a great question. So when I meet with the Chief Medical Officers of Health from the rest of the country, as well as Public Health Agency of Canada and Dr. Tam and Dr. New, we have the data for each and every jurisdiction. We've been tracking the data in terms of watching the numbers decrease in Canada as a whole. So in terms of going in the right direction and approaching this with that in mind, some jurisdictions already function without many interprovincial restrictions, and some provinces have more restrictions. So when you look at the entire country and what everybody's doing and the numbers of cases and the decrease in number of cases across the entire country, those discussions have started happening as a result of that. So that's all based on data, and so yes, it is based on risk, so and the decreasing risk across the country and for New Brunswick. I think the other thing that we take into account, again, with our close neighbors is looking at their numbers of decreasing cases or non-existent cases, and that we take into account as well. And then the other thing that we look at with respect to, again, when you're imposing restrictions from a public health perspective, they really have to be in line and in keeping with the risk. So as the risk changes, we adjust our advice. And if the Premier would like to comment as well, then I can, if you have something to add? No? Okay.
Thank you. Do you have a quick follow-up question?
Yes, I just want to also get maybe the economic side of this thinking from the Premier, if possible.
Sure. I think that, as we're looking at ensuring the safety of our citizens, but also ensuring the viability and getting our economy back up and running as quickly as possible, it's important to us to recognize where we can do this effectively. And as per, I guess, our process from the very beginning, we've moved in stages and we move back up in stages. I've had close conversations with my Atlantic colleagues about next steps and the Atlantic region as a bubble, which I think, we've talked about in general terms here in the last several weeks. And so the idea is once again to not only get freedom that goes beyond our borders, but in doing so have freedom that goes, throughout Atlantic Canada and then beyond throughout our country. Because at the end of the day, we want to get back being a nation. We want to get back to our friends, our relatives, our people traveling. We want to get the airports up and running, and we think just as we're supporting and promoting local activities right today, we need to expand upon that to national activities, so starting with the Atlantic side. We're moving quickly on the economic side. We've seen great results. I quoted some today. We've seen a different forecasting from RBC, from other areas saying, we think New Brunswick's going to be up, I think 95% recovered in the coming months by, let's say, or maybe late in the fall, early next year. But it depends, of course, on what happens in the fall and the second wave and all of that. But right now, I feel good about where we are. I feel good about where we're going, and we're working hand in hand with public health to get there.
Thank you, Premier. Thank you, Doctor.
Thank you.
Thank you. Michel Corriveau, Radio-Canada.
Oui, j'aimerais savoir, Dr. Russell, qu'est-ce qu'il manque pour qu'il y ait une bulle atlantique, selon vous?
C'est des discussions qui prennent place avec les médecins hygiénistes en chef des provinces et aussi avec les premiers ministres. Alors, c'est des discussions qu'on a tous ensemble et les décisions vont être faites sous peu, mais c'est vraiment toute l'équipe d'Atlantique qui vont travailler ensemble. Je voulais ajouter quelque chose au sujet de les avertissements de chaleur, maintenant au Nouveau-Brunswick, on a plusieurs places alentour de province, puis le premier ministre a ajouté des points sur le risque pour des feux, mais les risques pour des gens, certainement certaines personnes vulnérables peuvent être affectées, puis la principale cause de ça, ça serait la vague de chaleur. Alors, on a un niveau 1 à quelques endroits dans la province, puis on en a un niveau 2 à quelques endroits dans la province. Alors, je voulais que les gens savent qu'il faut vraiment prendre soin d'eux, puis vérifier sur les voisins, boivent et essayer de faire certain que vous buvez beaucoup d'eau.
Merci, docteur. Monsieur Corriveau, as-tu un suivi?
Oui, merci, Bruce. Alors, Dr. Russell, pour ce qui est de la zone 5, j'aimerais savoir quelles sont les conditions exactes. Vous avez dit peut-être d'ici vendredi, là, si ça va bien. Quelles sont ces conditions exactes pour qu'il passe à la phase jaune? Et est-ce qu'on parle de la même phase jaune que pour le reste de la province ou d'une première étape de la phase jaune?
Oui, alors, si c'est annoncé la semaine prochaine, qui est le vendredi, le 26 juin, si tout va bien, ça va être le jaune comme le reste de la province. Pour nous, tout de suite, c'était voir les premières 2 semaines pour voir combien de cas qu'on aurait eu, combien de temps que ça prendrait pour gérer la situation, pour faire certaine qu'on faisait les dépistages dans grand nombre pour nous assurer qu'il n'y avait pas des cas dans la communauté, qu'on n'avait pas, on n'était pas au courant de l'information comme ça. Mais au fur et à mesure qu'on a reçu beaucoup d'informations sur les dépistages, les résultats, les manières qu'ils gèrent les situations, les éclosions dans l'hôpital et aussi dans le manoir, à ce moment-ci, on a la confiance dans les choses qui sont déroulées et les choses qui sont améliorées et changées dans les 2 situations. Alors, ça nous donne la confiance que dans les prochains jours, si on voit que ça continue à être stable, on continue à avoir la capacité de faire certaine que les gens soient testés, sont isolés, sont contactés à la recherche. Si tout va bien avec ça, puis ça continue à améliorer, ça va nous donner la confiance à faire l'annonce la semaine prochaine.
Merci, doctor. Merci, M. Corriveau. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My first question is for Dr. Russell. As we work towards having an Atlantic bubble, if there is an outbreak in another Atlantic zone, and let's say that region is Nova Scotia or PEI, how will a collective interprovincial protocol be created to determine emergency travel restrictions?
So those are the fine details that the details that we're fine-tuning at the moment in terms of what does opening up look like, and then if there's a hot spot that develops with an outbreak, then what would be the measures that we want to put back into place. So those are the details that we are working out right now.
Thank you, Dr. Ms. Hogarth. Did you have a follow-up?
I do. It's for the Premier. Premier Higgs. Premier McNeil has said that he'd like borders between all provinces to be open by mid-July. I'm wondering what your position is on that and how you respond to people who think containing the virus for the summer just within the province is a better strategy.
So we've discussed this amongst the 4 Atlantic premiers, so we're all aligned that we hope to, expand across the country in mid-July, sometime in July. And so I understand and agree with his comments in that regard. We are monitoring activities across the country. We feel the first phase for us is obviously Atlantic Canada and getting, our Atlantic Canada colleagues together. And we've had discussions on that as recent as just last night about what that could look like and when. And that's why, I think you'll be hearing from all of us that it's likely sometime early July. And then, so as I mentioned earlier about moving in phases, so that being, where we are now, then the next phase and getting alignment completely with Atlantic Canada, because I think it's a great message as we work together to fight this virus, which gives us, in the future, I would say in Atlantic Canada, a better perspective on how to manage it as an Atlantic region. So we can move around and have more flexibility in our area. And then looking at in the later in the summer, depending if it all goes well, collectively being able to say, yeah, we're ready to move the next step into the rest of the country. We want our country back together again, and I think everyone believes that, but we need to do it in stages that everyone accepts as it's the right move to allow us to manage any potential outbreaks which are are most likely to happen.
Thank you, Premier. Thank you, Ms. Hogarth. Adam Harris, Telegraph Journal.
Thanks, Bruce. A question for the Premier. Just a clarification here. I believe you said the remaining businesses in New Brunswick that are closed can reopen on June 26th. Does that include things like casinos, amusement parks? Can you just elaborate here?
It does, actually, but again, following all the requirements of public health. And you also notice in terms of identifying too, in places where you would go in and be seated, the recommendations are to have a way that the businesses need to record that. So if any outbreak happens, it's easier for public health to actually move forward. These facilities would be monitored, and they can seek advice and get advice from WorkSafe, as with any other business. But yeah, it's moving beyond the prescribed number of people that could be attending a business to actually allowing the business to meet the health requirements and to open up based on, let's say, the size of their facility, and that could apply to many different businesses.
Thank you, Premier. Mr. Harris, do you have a follow-up?
Yes, please, Bruce. Again, for the Premier, I just want an update on the contact tracing app. You said that you were going to speak with the Premiers and the Prime Minister last night. Did you get any clarification? Is the New Brunswick app dead in the water?
Oh, yes, I guess I got clarification that there's one app, and it's a national one. And it would seem at this time that, which is concerning, despite all the great work that our people have done internally here, the folks that were working diligently to get up and running quicker. It's kind of stopped until we have access to Google or Apple Play or Apple. And the idea, I guess, is we felt we could get up and running sooner. We felt we could get into a position and be able to supply a national app. So we all agreed, as I think, Adam, as we've discussed earlier or before, we all agreed that it needed to be an app that would allow information sharing. It needed to be one that met all the criteria for privacy. And as long as it had that capability, then what difference did it really make? But the federal government have chosen an app. They're going to pay for it. I just hope we can expedite it as quickly as we felt we could otherwise.
Thank you, Mr. Harris. Can everybody please put their phones on mute if they're not asking a question? Merci beaucoup. Matthew Wacomo, l'Acadie Nouvelle.
Bonjour. C'est concernant les proches, les gens qui ont de la famille au Nouveau-Brunswick qui vont pouvoir venir les visiter à condition de s'isoler durant 14 jours. Qu'est-ce que ça veut dire exactement pour eux? Quel genre d'isolement? Est-ce qu'on peut être en contact malgré tout avec les gens qu'on visite? Est-ce qu'on peut venir visiter pour moins de 14 jours et quitter ensuite? Donc, en gros, j'aimerais connaître les conditions d'isolement qui devront être respectées par les résidents canadiens qui visitent leur famille au Nouveau-Brunswick.
Oui, excellente question. La santé publique a des directives sur comment faire l'isolement. Alors, ça veut dire que dans la maison où vous isolez, ça veut dire que c'est mieux d'avoir une chambre à vous-même, votre propre salle de bain. Mais les gens que vous demeurez avec, eux, ils peuvent faire les activités normales. Et l'autre partie de votre question, c'est non, ils n'ont pas besoin d'être ici pour 14 jours ou plus. S'ils viennent pour moins de 14 jours, ça suffit qu'ils vont faire l'isolement durant la période de temps qu'ils sont en visite au Nouveau-Brunswick.
Merci, docteur. Monsieur Roy, comment as-tu un suivi?
Oui, merci, Bruce. Celle-ci est probablement pour le premier ministre Higgs. Dans ce qui pourra rouvrir le 26 juin, mon collègue Adam vous a parlé des casinos et des trucs comme ça. Je me demandais si ça concerne aussi les salles de spectacle, petites et grandes, et quelles seront les conditions qui devront être respectées dans ces salles de spectacle et autres lieux culturels.
So I didn't get half.
No, the first part. Get him to ask.
Monsieur Wacomo, peux-tu répéter la première portion de votre question, s'il vous plaît?
Yeah, it just wasn't coming.
Oui, je veux seulement savoir si les lieux culturels, les salles de spectacle pourront rouvrir bientôt, si ça fait aussi partie du 26, des réouvertures du 26 juin, et sous quelles conditions elles pourront rouvrir, si c'est vraiment le cas.
Yes, that is true. They are included, and it would same be with cultural places, churches. So the same situation of it can be dependent on the size of the facility. They need to follow all of the public health requirements and social distancing, and keep a record of attendance, so that again for the contact tracing we're able to make sure that we can track if needed. They will need an operation plan later, so as part of it, they'll need that in advance, so they can actually have a path forward that meets the requirements, and it's not haphazard, because the point of doing this is allowing our society to get back up and running, while all the while never losing sight that the virus is present in New Brunswick. It could spread quickly, but the more we follow the rules, the better we'll be able to manage, the more activities we can experience and move forward under, and that's our goal.
Merci, Monsieur Premier Ministre. Thank you, Premier. Merci, Monsieur Wakoma. Laura Brown, CTV.
Hi, Premier. I know you're likely tired of questions about the Atlantic bubble, but early July is weeks away, or really less than 2 weeks away. Can you give us any more insight into if you're going to announce an opening of being able to travel among the Atlantic region? Will there be a heads up, or will it be an effective immediately today announcement?
No, the plan would be certainly to give an advance notice to allow other establishments, I'll say, whether it be throughout our 4 Atlantic provinces. So if it's hotels, it's reservations to be made. It's to give businesses a chance to be able to accommodate changes, restaurants, all the activities that we want to have benefit from opening the Atlantic region. We would want to give them ample notice. So I just would say that even right today, they should be thinking about early July, but I'm still working with my colleagues, and we would intend to be in a position to announce that really together in a very short period of time.
Thank you, Premier. Ms. Brown, do you have a follow-up?
Yeah, I'm wondering if there's a delay because of the situation in Campbellton. Are your Atlantic colleagues concerned about our situation, I guess, in that region?
No, it really wasn't in the case of, and I could understand, because right today in the other provinces, they have less, I think, active cases than we do. But no, that wasn't the concern. Is they also have been in a self-isolation mode for the 14 days. Certainly, there's varying degrees within provinces of the comfort level as we open up to new people coming and going. And that was pretty general across the board in the other 3 provinces as well. So to get alignment here so that we open up, people then have the same rules, and it's been my focus from the onset, and it's our focus collectively as 4 premiers, to allow people, once we're open, to say, look, I'm in Nova Scotia right now, the rules are different. No, we don't want to be there. We want to be in a position that we're all have the same rules. We all can move up together, and I just feel it sends a great message for us to be working together to restart in an additional way our economy here in the Atlantic region.
Thank you, Premier. Thank you, Ms. Brown. Caitlin Dutt, Telegraph Journal.
Hello, I'm not sure who this question is for, but we've seen instances of businesses in areas, for example, campground in Deer Island, refusing to accept out-of-province people into their campgrounds. And the mayor of Grand Manan also seems to suggest that he does not want out-of-province people there. So I was wondering, are businesses and small communities allowed to refuse to accept or to serve people if they're outside of province or outside of the Atlantic bubble, or even in the Campbellton region?
Well, certainly we're encouraging, as Dr. Russell has said, we're not restricting movement in and out of the Campbellton region, and that's is to get our province back together in that regard. As far as outside of the New Brunswick region, then the restrictions are there unless they're very particular, like if someone is here, they're here for a funeral and they are here with a camper or trailer, whatever the case may be during that time. But as far as general travel from outside provinces to campgrounds, I mean, that is not a permitted activity right now from outside provinces without, being able to isolate. So it's not normal not being permitted at this stage. So a campground, a private operator who is trying to protect their business and at the same time follow the rules that exist today, I mean, I don't think I can fault them for that.
Thank you, Premier. Ms. Stutt, do you have a follow-up?
Yes. So I was just wondering, what about for people who have property, let's say in Grand Manan, and who are coming from, like, let's say Quebec or something?
So we've said that people that have property that are coming from outside of New Brunswick will be allowed to come to their property, and they will be allowed to, they have to self-isolate there. So for as long as they're there, the 14 days, if they're there that long, if they're there for 7 and return, then that's fine. But we are suggesting that, or we are making it part of the requirement. We recognize those that have properties, and we want to allow them to have access to them.
Thank you, Premier. Thank you, Ms. Stutt. Silas Brown, Global TV.
Hi, Premier. You seem to suggest there, answering a previous question, I think it was Laura's, that you're working with your Atlantic colleagues here to try and harmonize the rules present in each province. With a couple weeks left to go and 4 provinces that have had 4 different approaches to opening, is that something that we can expect, that we're going to see a fully harmonized and potentially see changes to our own rules here based on what you and the other premiers and their public health apparatus can agree on?
That's our goal.
Thank you, Premier. Do you have a follow-up, Mr. Brown?
All right. I'm curious I know that you somewhat addressed this, but Nova Scotia seems to very much have a desire to be open to the rest of the country by mid-July. That's not very long after early July, and you're more suggested late summer for a time to be open to the rest of the country. Is that a sticking point between you and any of your colleagues, or between McNeil and colleagues in these discussions?
Well, what I found in our discussions is that, the kind of the logic and the facts as we look at where we are in the Lank region, where we are in Canada, generally, that speaks for themselves. So we discuss, okay, what's our positioning? And so as we look at, just I said about when the Atlantic bubble would occur, it was related to, okay, how comfortable are we all to be able to do this at the same time? The same thing will apply to the notion about the rest of Canada, because we all have that same goal. We all want that to happen. So, whether it's mid-July, 3rd week July, or late July, it'll be. I think we'll get ourselves all on the same page, because at the end of the day, we know it's required to start up the economy. We know it's required in order to get airports up and running, to get people moving around again, and so unless we got a real significant outbreak of some sort that would delay that, I would say that the path we're on right now would allow us to certainly get harmony about the timing of when it should be, sometime in, I would like to hope too, sometime in mid to late July.
Thank you, Premier. Thank you, Mr. Brown. Elizabeth Fraser, CBC.
Hi there, my question is for the Premier. Under this new phase, New Brunswickers will be able to leave the province and not have to self-isolate on their return. Can you elaborate or explain how that is supposed to make people feel safe, especially since it's been suggested one person's travels to Quebec led to the current outbreak in Campbellton?
So this applies to workers who have been traveling across the country. So you could say it's the next generation of allowing movement of people that are coming back to their families. They're doing it every 2 weeks or every 3 weeks. We're asking them to closely self-monitor and obviously get tested if any symptoms arise. They've been doing this now, let's say, for 3 months, 4 months, and they've been doing it by coming home and self-isolating. So this is kind of the next phase of saying, you know what, we recognize there's a need to move across the country. We recognize there's an opportunity here to get families back together. And I think it's important to point out that this applies to workers only, that this applies to people that have work elsewhere in other provinces. And we've been doing that in New Brunswick for several months really now too, under more or less the WorkSafe rules when tenders are released and contracts are awarded, and we've been moving people around and isolating and developing a plan with WorkSafe. So this kind of is a natural progression, and you know, as we move, that creates a little more exposure, but that's life with COVID, and as we get back to a new life with COVID, we have to find a way to deal with it and keep moving.
Thank you, Premier. Thank you, Ms. Fraser. Do you have a follow-up, Ms. Fraser?
I have another question for the Premier. What does the province say about people from outside New Brunswick or Atlantic Canada looking to retire and reside in New Brunswick? Can they come into the province now to try and find a place to live? And the reason I'm asking is I have been speaking to a couple in this situation who has said they haven't been able to find anyone in government who knows whether they can come into the province. Why is that?
So anyone who wants to move here to New Brunswick, I mean, we certainly want to find a way to accommodate that, and we want to encourage people to come here and live here. So I'm sure we can work through that. I think what probably the nuance here is that someone who wants to come here and be in a position to shop for houses and just, you know, travel around the province and from one house or around the province or around the different city and just go from one house to another, that would be a problem. If they come here first and isolate with friends and family, as we're allowing, you know, that to happen, then that would be a case where, okay, they do the isolation first. So it is problematic. Today, I would say that they should do some virtual shopping and then kind of decide where they're looking to focus. And we want to encourage that. So then we go from there, and by the time they get there, maybe we're in a different phase of opening and it becomes less restrictive as we want to encourage people. As we're saying, early in July, we hope that would not be a problem at all for Atlantic residents to move through and look for, you know, houses here in New Brunswick. It might be a problem for another few weeks in relation to someone coming from another part of Canada.
Thank you, Premier. Thank you, Ms. Fraser. Savannah Odd, Telegraph Journal.
Hi, Premier. Vitality has said they have enough staff to maintain capacity, but the Campbellton Hospital's ER and other services remain closed. And they've got just over 40 employees sidelined, either infected or isolating as precaution. What is government doing to support a safe reopening there?
So Vitalite is working very hard to make sure that the services that can be provided are being provided. Just as background knowledge, the northern part of the province has always had some challenges with staffing pre-pandemic. So we know that even without a pandemic happening, there are challenges with respect to staffing in the north. So taking that into account as the background with a pandemic on top, again, they're doing things right now that are safest for the patients and for the staff. So when they have the ability to open up the rest of the services, they absolutely will. But again, their plan right now is protecting staff and patients, and also, again, providing the services they can provide. So the entire hospital is not closed down right now. I feel like their bed capacity is over 100, perhaps maybe 150. And so there are still quite a few of those beds occupied currently. So it's not a complete shutdown, but it's about providing the services that they can when they can, based on the current situation.
Thank you, Dr. Missad. Do you have a follow-up?
Yes, I do. Thank you. I'm just wondering, Dr. Russell, if you could run me through what specific parts of the yellow phase would apply to Zone 5 next week. I know we saw kind of some staged approach with the rest of the province. I'm just wondering if that will apply. And what triggers to cancel the plan would be in the next week?
So with respect to going to yellow in Zone 5, it would be a complete yellow phase. So there wouldn't be a phased approach at all. It would just be completely yellow. And really, it just we're just cautiously looking at the data and looking at the situation in terms of any new cases and if everything is being done that can be done. And I think if we stay on the same track that we're on right now, we're extremely comfortable and confident that we can go to yellow next Friday. So we haven't seen community transmission whereby there are cases in the community that can't be tracked back to the cluster and the outbreak with respect to all being close contacts of cases. So if there was a situation where we were seeing people who weren't connected to that outbreak in terms of close contact tracing, then we would be more concerned, but we're not seeing that. And the ability to continue to test at very high levels is there. So offering that testing around the province right now is really key as well to maintaining that level of confidence.
Thank you, Doctor. Thank you, Ms. Ott. Mia Urquhart, CBC.
Thanks, Bruce. My question is for Dr. Russell. Can you explain why you're only requiring one symptom for testing? Are you concerned we'll fall below the minimum number of tests to make the data relevant?
No, at this point in time, we're just making sure that we have that we're making sure that everybody who can be tested will be tested in terms of, again, looking for community transmission and making sure that everybody, because we do have pressure from different organizations at times to test asymptomatic people, and we have very, very special conditions under which we will test people that do not have symptoms. And again, we just want to be careful around that because we know the evidence around testing asymptomatic people is tricky with respect to how it influences the interpretation of the results. So in order to really be confident in our results, we are lowering the number of required symptoms to one, again, to make sure that we're not missing anybody, and we want to confirm that there is an absence of community spread out there at this moment in time. So it's giving us a level of confidence, but it also, again, gives confidence to the population in all communities that the testing is available for them when and if they need it.
Thank you, Doctor. Ms. Urquhart, do you have a follow-up?
I do. I'm looking for a little bit of clarity on sporting events and water parks and things that will attract more than 50 people. Is physical distancing still required in situations like that?
Yes, absolutely. So WorkSafe and Public Health have worked to provide general guidance around what that looks like. And so businesses who have the capacity to operate in a way that's very safe, that ensures physical distancing, are able to do so. But the other thing, when you lift the cap of a total number of 50 from those type of gatherings and situations, more so indoor than outdoor, but certainly having the ability to contact trace if there's an outbreak means that we really encourage all those types of facilities to collect contact information so that we can do contact tracing quite quickly. So it's about being aware of the risks and what we need to do to mitigate those risks. So certainly, again, there's levels of risks. We really want people to be aware, again, what things are riskier than others and what are the types of measures that you need to take to counteract those risks and protect yourself and protect others. I did speak about the HARS alerts, the heat alert response system that is activated around the province right now. We have several sections of the province that are at level 1 heat alert, and then there's at least one that's in level 2. So what that means is that the temperature in the province is going to be at a certain level for a certain amount of time. And when it comes to vulnerable populations, especially types of outdoor activities that you're doing, we want people to be very aware of drinking a lot of water, making sure that if you can go to a cool setting with a fan that you do that, stay in the shade, etc. So we do know that people who have underlying medical conditions such as lung disease, cardiovascular disease are at higher risk. So we want people to check on their neighbors. We want people to really be aware within their communities if there is anybody who needs to get some help and make sure that they're not in danger. And I do actually want people to be very, very careful in this heat Normally, when the level of the temperature increases very quickly, it does take the human body about 2 weeks to acclimatize to those increase in temperatures. So people think, oh, well, it's just a nice day, it's hot, what's the harm? But our internal regulation system for monitoring our body temperature doesn't quite kick in as quickly as we would like. So it does take about 2 weeks to acclimatize, and our body's getting used to being able to monitor our temperatures and adjust. So during that time, we are more vulnerable. So it is really important to rest more, drink more water, stay in the shade, and spend as much time in a cool area as possible with a fan. And if you need to put water on your hair, your face, your clothing, please do that. Because again, the risks of heat illness are there. We do see more hospital visits during this time with people suffering from the effects of heat illness. So we're trying to protect people from all those different types of heat stress and heat stroke under these types of conditions. So please be aware, look after each other, and drink lots of water, please, and especially look in on your vulnerable neighbors.
Thank you, Doctor. Thank you, Ms. Urquhart. Mike McDonald, Canadian Press. Harry Forrestal, CBC.
Thank you, Bruce. This is a question for Dr. Russell. Doctor, could you speak to the inevitability of a second wave that we've heard so much about, and the planning on your part and the part of your teams to anticipate its arrival and what it will look like?
So these types of discussions have been happening sort of on a low level throughout the pandemic. And like all of the information that we have garnered throughout this pandemic, we do connect very, very frequently with the Public Health Agency of Canada, all the Chief Medical Officers of Health across the country. And so at this point in time, we are, I think, at the stage where we can look back on what has transpired, what learnings we can take away on how the virus has been controlled within each jurisdiction, and what learnings we have at this point in time. So moving forward, again, we know how we've handled this first wave. We know what things worked, what things didn't, what things we need to look out for. Our hope, obviously, is to continue to be able to deal with the low-level type of transmission that we're seeing with isolated clusters and isolated outbreaks. If that happens to be the pattern throughout the rest of the pandemic, great. That means that we can continue to have a functioning society and economy in that context. For a second wave, though, I think the entire planet is going to be worried about that. And obviously, some countries around the world haven't gotten through their first wave. So there is, again, more information, more learnings to be observing and monitoring at this point in time. But as we get that information, there is a constant planning team within the Department of Health and within the whole of government in terms of the approach. So these are things that we constantly review and consider as we move forward.
Thank you, Doctor. Mr. Forrestal, do you have a follow-up today? Harry?
Sorry about that, Bruce. Thank you.
No
I do have a second question. This is for the Premier. Mr. Higgs, there was an emotional and a rather anguished cry for help from the Mayor of Campbellton. She pleads in a Facebook posting for your help specifically, suggesting that her workers and citizens in that area do not feel safe. We also heard from a doctor, a GP in that area, who expressed concerns about the way the COVID-19 outbreak in the Campbellton Regional Hospital was being handled. Have you responded to the Mayor of Campbellton in her plea specifically for your help? And what concerns do you have going forward with the integrity of the response to the COVID-19 outbreak in Campbellton?
So firstly, I'd reiterate what Dr. Russell said earlier about the actions that Vitality is taking, and that Vitality is taking in the area in order to address the use of the personal protective equipment, and all of the kind of additional training and access. We do have lots of equipment. We are following national protocols. I think there's probably been some lessons learned through this, which was kind of our first, major outbreak as such, and it happened to be in the Campbellton area. The hospital, as Dr. Russell referenced as well, it's been a challenge with finding a number of employees in the past. So it's even kind of more of a challenge in that regard, but that's why some changes were made to the operation because of the people that are on isolation right now. But I think there's been a whole renewed effort in relation to how equipment's being used, how to protect the workers, the healthcare workers there. At this point, I believe there are only 2 cases, maybe even 1 case that's in ICU and that's an active COVID case in the hospital. So I think Vital, they have it under control. I think they're very focused on it. It's myself or the Minister of Health will be working with the folks in the Campbellton region, with all partners in that region in relation to ensuring that we have a path forward. Because what we learn here from this outbreak in Campbellton helps us to be better at what can happen in any part of the province as we continue to open up. So this is an experience that I believe we've already put in place what's already been learned. So it's unfortunate that, we get into the anxiety that's as natural, and we will try to work with officials there to ensure that their concerns are recognized and that we are mitigating them wherever we possibly can.
Thank you.
Thank you, Mr. Forstall. Thank you, Premier. Michael McDonald from Canadian Press. He's on the line, but he can't listen to your desk, so we're gonna have to close it. Okay? Okay, Mr. McDonald, you can email the questions if you can't ask them. Thank you. That concludes today's update. Thank you very much. Voilà la fin de notre mise à jour. Merci beaucoup.